The baby was born full term. Everything looked normal, but the baby did not cry, and time was ticking. We needed to do something and do it fast. Hi, welcome to another episode of Patient Case Files with Dr. Happiness. I am Dr. Happiness, and in this series, I discuss real patient stories that I have observed over my more than 30 years practicing as a medical doctor. Some of these stories are intriguing, some are weird, but there are lessons to learn that will help you in life and to understand medicine. If this sounds like what you're interested in listening to, then sit back and let's dive into today's story. Today's story is about a 24-year-old lady pregnant for her second child. She did antenatal. Her antenatal was normal, no complications. Then she came in labor. The labor lasted for about 7 hours. At the time of delivery, the baby came out fine, but did not cry. Started becoming floppy. The baby was cyanotic. He was turning blue. The heart rate was going down. We had to act fast, otherwise we can lose the baby. So what did we do? We grabbed our bag and mask and started resuscitating. We now put the baby on oxygen and then transferred the baby to the neonatal intensive care unit. The baby stayed in the NICU for about 4 days, got better, and was discharged. Now, why was the baby turning blue or cyanotic? The baby had meconium aspiration. Meconium is the first poo a baby passes after birth. But this baby passed his meconium while coming out of the birth canal, and so in the process aspirated some. So some of the meconium entered his lungs. We had to act fast, because if the brain doesn't get oxygen in 3 to 5 minutes, it could die. And if such a baby survives, if nothing is done fast, the baby will have neurological problems. The baby might not be able to talk well or walk well. So early intervention is crucial. We have to aspirate to clear the lungs of the meconium so that air can enter freely. Place the baby on oxygen to supply him with extra oxygen while the lungs are trying to recover. It is important to be on the lookout for warning signs of neonatal complications. Doctors, nurses, and parents should be on the lookout for neonatal emergencies. What started normal could end up in a very devastating way. For pregnant women, it is important you get to the hospital early. Some of you, especially after you've had the first pregnancy, and you know first pregnancies, the labor is usually long. So they say, no, I don't want to go to the hospital on time so that I don't have to stay long in the hospital. If you come to the hospital on time, any early signs will be detected easily. Don't stay at home. Go to the hospital as soon as you get the first sign of labor. In fact, if you are not sure that it's labor, it is better you go to the hospital and let them tell you that it is not labor than staying at home and gazing. So we are happy that we're able to save that child's life because we have the gadgets, the oxygen especially, to put the baby on. On the day of follow-up, the mother was saying she was surprised. She thought baby's cry was just noise, not knowing that baby's cry is life. It is when oxygen gushes into the lungs of the newborn baby that makes the baby to cry. So that first cry gets oxygen into the baby's lungs. It is a cry of life. If you found value in today's story, make sure you don't miss next week's story. It promises to be powerful and educative. Like this video, comment in the comment section. If you have experience such as a nurse or a doctor or as a parent, share, subscribe, share with people that you think might find this video useful. And keep a date with me, Dr. Happiness, next week, as I bring to you another intriguing and powerful and educative story that will open your eyes to the things that people go through, to let you in on what we doctors see in our consultation rooms and how we go about getting our diagnosis. Remember to keep a date with me next week. And together, let's build healthier and happier families. Thank you.